Morning. Good evening and welcome to all for the session today. So first of all, my congratulations to those of you who have booked the slot, and my kind request to all of you who haven't booked today, please wait for the slot, okay? So don't lose hope, don't get frustrated. I know this is a very difficult and very challenging time. Unfortunately, sometimes there's a technical glitch. So this almost happened more than a year back. It was in May 2021 exam. When the booking slot opened, there were a lot of confusions. Quite many couldn't book. So there were a lot of rearrangements. So I would like to take this opportunity to request you all who haven't booked the slot so far, just be patient and wait for the mail for the RC from the RCOG, as well as you can just keep yourself updated. Like you can just you can ask your family, your friend, your husband, or whoever has got a good net connection, because some of the girls who had complained that they had for quite some time there was a lot of technical glitch, but some others who could book from those places where they got a very high speed internet connection, they could able to make it. Okay, so take this as a good opportunity to get yourself prepared for this, having a good internet connection, having keeping your laptop desk free, because see, if the internet connection is good, sometimes the laptop is overloaded with so much of materials, with so much of your slides, your study materials, your guidelines. Sometimes the laptop may have some difficulties in the speed. Okay, it's not just your internet speed, so just take care. See that you use a laptop. Suppose if you're using your laptop for studying purposes, for reading, for attending sessions, for attending courses, so you can use some other laptop, maybe from your husband or from your children, or from your friend, which is which has got less memory. Okay, that's got more space in the laptop. Okay, such things in such laptops, the browser will be able to open faster than those laptops whose hard disk is whose memory is full. Okay, so this is again one more tip for you guys. So please wait for the updation from the RCOG. RCOG is publishing the website itself, so let us hope and wish and pray that you all get your booking slot. Okay, so until then, keep yourself cool and composed and continue to prepare. Okay, so this is just the beginning of a great journey to finish your last leg of your MRCOG. Okay, so having said that, let us go into the session per se. So some of you would have booked for the face-to-face slot in Chennai or Kolkata or in Cairo or in Abu Dhabi. Some others would have booked for the remote online. Okay, so just keep yourself, make sure that you got the confirmation mail from the RCOG, and make sure that your banker, the credit card or the debit card, the bank person, the bank has received, has sent you a mail or sent you some transaction paper, or you can download your statement and keep it for your own personal reference. All right, so that could be an ideal thing, so that will help you in any future queries or communications with us. But so having said that, so at this point of time, so all of you will be in the peak of your adrenaline rush. So what we will be telling you is now very, very simple exam-oriented tips, right? So what are those? Let me share my screen for that. So I always believe in this formula of together we can. It's always a teamwork, and you win and I win, right? So together we can. So it's a teamwork. So when you win, it's our win, and when we win, that's your win. So what you will be doing from now on is try to have at least one study partner, 2 and 3. If at all, if no one is having a study partner, please get, there are a lot of groups, including my group, so you can just request someone to be a study partner, especially those who have already booked the slot. So that would be an ideal set. So you'll be, both of you, or all the 2 or 3 of you, will be in a good frequency and a good tempo. The second thing is, see, you may be working in whichever setup you are. So try to keep yourself some allotted study time. Split your study time into 2 or 3 sessions per day. So for example, morning you can do a 2-hour study. In the afternoon or evening, you can do 1 or 2 hours. And in the night, you can sit for 2 to 3 hours before you sleep for the night. So no one can study together for 5 or 6 hours continuously, especially if you're working. So you can start doing it from now on. Now it is September 7th, so November 7th is the exam. So from now on, you can start making your schedule this way, so that you can study as well as whatever work or your practice or you're doing, you can do. So speak with your family, speak with your, take adequate leave at least 3 weeks before from your job, your practice. Arrange everything with your patients, all the emergencies you try to hand over to anyone else, your friend or colleague, and so that you can focus yourself these 8 weeks for your exam, right? So morning slot. So what I mean by this, split your study timing into 3 different slots. So the morning slot, you can do some recall stations, recall tasks. The afternoon tasks. In the afternoon, you can work on some book stations. So you can start practicing very much into Oxford, and we recommend you certain books, the Lisa Joyels and the MRCOG book. So we can start working on those tasks. In the night, you might be undergoing some courses, or you have already finished a course, you have joined some crash course, you have joined some, or you might be doing a self-study with your study partner, whatever may have been. You can do all those, you can revise all those tasks, along with try to revise a couple of talks every day, okay? So in the structured discussion, you can now with this November exam that you guys are going to take, so at least try to make sure that you are thorough up till April 2022 talk. That's a very important thing. So structured discussion could be any way. So you ought to be thorough with all these things, okay? So we'll be posting you some tasks related to the talk. We'll be posting you some infographics. So every now and then something will be posted for you. So please follow the group, and you can keep yourself updated. So those of you who are going for a remote online exam, please do a video practice, okay? And with the timer on, please record them. So that will help you to improvise yourself. So you do a morning slot, 2 hours, sit with your study partner over the video call and with the timer on, and then let her give a critical review of you, and you do the same to her, so that you'll be able to watch how you have to improve your facial expressions, how you have to improve your voice modulation, how you have to improve your language, your timings. So everything you can improvise on your own self. Those of you who are going for a face-to-face exam, kindly, if not done so far, kindly try to do a face-to-face practice. All right? Or if you find it difficult, right, like you work in a place and your study partner works in another different hospital or another different city or another different country, that might be a little challenging. So in that case, at least you can do a open video call practice, but we're not very sure at the moment what about the timer in the for the face-to-face exam. Is it pre-COVID days, those 2 minutes, 10 minutes buzzer only, or is there anything else? So we are ready to hear from the COG. So until then, for the face-to-face exam goers, please make a video practice with your study partner, but don't keep the timer. Let your study partner note down your timing for the information gathering, how much you took. So let that be only the 2 minutes and the 10 minutes buzzer. So there should not be any display of the timer in front of you. However, at least 2 tasks per day, you sit at home or in your clinics or in your hospitals, and do a face-to-face practice with anyone, not necessarily a study partner. If you have the study partner who can travel to your home, or you can go to your house, so that is a different story. Or if you got a study partner as a colleague in your same hospital, that could be one of the best things. If at all, if you do not have anything like that, if you do not have any convenience like that, please do not worry. Take your child, your grown-up child, if you have a daughter or son, or you can take any husband, a doctor husband or a non-medical, that doesn't matter. The only thing, they should be able to communicate with you in English, all right? Even if your parents or your sisters, your brothers, your friends, your neighbors, even if your maid or driver is good in English, you can utilize them, or they can speak some reasonable, good, understandable English. You can utilize them, okay? So try to make them as a role player, give them the instructions, and then you try to do a face-to-face practice, just like how, if you can watch some Lisa Joel videos or strategy videos, you can see how two people are sitting across the table and having the task done. Okay, such things you can start doing from now on. Okay, so this is the least minimum thing, at least, that you should do for a face-to-face exam goer, even if you don't have a study partner who's going to sit in front of you. All right. So having said that, right. So again, as I told you, the face-to-face examiner is going to be, the face-to-face exam, we are not really sure of the timing. So let that be only 2 minutes and 10 minutes. Also, from now on, please make someone else, preferably a non-medical person, at your home, in your clinics, some nurse or some technician, or not necessarily a nurse, even some administrative staff who is friendly with you, who's able to help you, or a reception staff. You can ask them to just be a lay examiner, okay? And please ask them to make a critical comment on you, how you speak as a lay person, how far they were able to, judge you as a lay examiner, okay? Such tips is going to help you a lot, especially when you sit for your face-to-face exam. At home, if you got your husband as a non-medical person, or you got a grown-up child, or anyone else, as I told you, you can bring any one of them into the scenario as a lay examiner, and at the end, how they felt. So they judged you, how far you are empathetic, how far you're good in your communication, how far you were giving the time and space for the role player to communicate with you. Okay? All these things you'll be able to improvise on this. So these are the few things, and very, very important things, that you ought to do before you sit for this exam, right? So as I told you, please try to take at least 3 weeks before the exam, try to arrange leave or off from your duty, from your practice. So set aside all the elective ones, if at all, if that's your own private practice, or you can hand over to one of your colleagues. See that you are not in a busy setup, or even if you're in a busy setup, try to take off. Very, very important. Not only off from your office, from your hospital, from your day-to-day duties and practices. Please speak at home, speak with your husband, or speak with your children. Try to arrange, if there are small children and if they ought to be taking care of you, seek extra support from your parents, your siblings, your friends. Okay, try to keep yourself available for you to, practice hard and hard. So that you have to give the best in these 2 months. Okay, so even if if the bygone days be bygone. So some of you guys I know are very busy running up and down, couldn't even do even a single task so long, but still, I know the few who got a slot, but unfortunately they have not yet to start their practice. Their studies, their preparation, I would say. All right. So that's why we ran a crash course for those guys. So this apart. So speak everything with the family, arrange everything with the family, with the husband, with the children, the grown-up children, and seek extra help and support from your from whichever side which is favorable for you. So seek their help, okay, and try to do some basic minimum physical activities, these basic minimum physical exercise to de-stress yourself. Try to do some yoga or meditation, that's possible. All right, just 10 to 15 minutes per day be a good investment for the whole of the day. All right. So, so this is what you will be doing from your side to start with. So I always say you have to split your task this way. All right. So as you know, we have 10 minutes task and there's 2 minutes and 30 seconds preparation time. Conservative management. Yes, Neha. You're true. Conservative management. Right. So as we are aware, it's 2 minutes and 30 seconds preparation time for the online global exam candidates, whereas just 2 minutes for the face-to-face candidates. So face-to-face candidates, please start taking, even when you're attending the courses with me or with anyone else, or with the mocks, try to have a small notepad and write in pencil. So that's what usually RCVT does, all right? So take 30 seconds loading time. As you know, 30 seconds loading time for the online exam quiz, and 2 minutes to read and take notes. So friends, please understand this fact that it's a totally interactive exam. So I would always say it's a performance of the task. Okay, I always use the word performance and nothing less than that. It is not, attending a practical exam. I won't say it's attending a practical exam or attending a Viva voice. It's not an interview as well as it's not a lecture. It's a totally interactive exam where you will talk and the person sitting in front of you also will talk. In a the person sitting in front of you, there's a role player who's going to talk. So the more you allow him or her to talk, the more marks you will get. So what I'm trying to put you into this piece of information is, just like how you and me are professional doctors. So we study so many templates, we do so much preparation to present a task. The same way, we are being trained to have a definite script to enact, definite set of dialogues to be spoken, definite emotions to be displayed. So they are professional actors, just like you and me are professional doctors. They are professional actors from the Royal Academy. Okay, so they do have a definite script. Okay, so they will travel according to their script. So it's up to you to allow her to speak. Give her time. So don't rush into your own agenda. That's why candidates fail. Unfortunately, 1 mark or 2 marks or just very few marks. Okay, for the freshers, please, whoever is going to take the exam for the very first time, please understand the fact that this is an interactive exam. All right. So the more you allow her to talk, the more marks you will get. The same way, the examiners, it's not an interview. They are not going to just ask you, just have something and keep quiet. No, it's a structured discussion, a case-based discussion. It's a why one. So they will ask you questions and please pay attention to whatever they are saying. So just don't rush into whatever you know, whatever those things that you studied in your templates or your guidelines or patient information leaflets, whatever you're going to say, please don't. So that's where the mistake comes. What I'm trying to say by this, you will be able to understand when we do the tasks. However, take it one final word that you have to remember, take home message for the day is allow the role players and the examiners to talk. Because if someone talks, if you allow them to talk, whatever question is being there in the script, they'll be able to ask. So if at all, if you missed something, or if at all it's something new, you'll be able to answer that. Also, please pay attention. Suppose if the examiner is going to ask, could you please tell me the antenatal management of this patient? Just talk with antenatal management. Don't, just because you feel that your time is going, or just because you are very sure of what you're speaking, don't say antenatal. If you ask antenatal care, just don't travel to intrapartum, postpartum, and contraception and the pre-pregnancy counseling for the next pregnancy. Please, my friends, don't do this mistake. Because whatever you're going to speak after antenatal care is not going to get evaluated. and then you'll be unnecessarily losing this time. The next question could be, could you tell me the intrapartum management of this patient? Again, you will think that I've already told all these things. Why this examiner is asking me to repeat? Sometimes you will think that since you have already told that, you would miss a couple of points, or you feel you get bucked up, you get bored. Why I should tell all this, and you might miss a couple of points. But believe me, friends, if you're not going to say in total everything of that intrapartum management of whatever he's asking, again, you will not be scored for this. So that is one of the reasons that candidates tend to fail. So please pay attention to whatever the examiner is questioning you. If you don't understand, you can call a class. Sir, could you please rephrase the question for me? Sir, could you please repeat the question for me? Or madam, could you please repeat, or doctor, whatever you want to say, right? So that could be a better approach rather than they ask you something, because in the stress of the exam, candidates, when they finish the exam, they come back to us and tell, ma'am, these are the questions they ask, and I answered these things. Then say, ma'am, you're asking this, but in the slip of my mind, I was just thinking that he was asking only one particular thing. So I forgot to say the other thing. So this is very, very common to occur in the exam. So please, friends, from now on, try to approach the exam in the way that you're expected to do. So I would always say the two things for any session: the content and the methodology. The content is what are all you've been studying so far, your guidelines, your PILs, your courses, your study materials. So you'll be running from pillar to post, running from one course to another. You study something in a long course, you go to another mentor for a crash course, you go for a couple of another mentors for the mock, you attend so many free sessions. Everything is absolutely fine, and you ought to do it so long. But from now on, you have to have a fresh approach. You would have done the same task with your study partner 200 times. You could have been taught by different mentors in small different ways of the same task. Believe me, my friends, this task, which is just in front of you, it could be an ectopic pregnancy, it could be a premenstrual syndrome, which you have studied in recalls multiple times. This time, if you are going to speak from your old mediocre memory, believe me, this is not the exam where you can memorize something and recite. Unfortunately, it is not so. Okay, so please take it from me. Even if you're doing a simulated patient task or a structured discussion or a teaching task, okay, don't expect what has been asked before or what you have been only taught. Okay, so whatever you have studied, whatever is there, your preparation so long should be at the back of the mind, and that you should be able to take and present in the front. However, in the forefront, it's your fresh approach, it's your open-mindedness, it's your attention, it's your interaction with the role play. So I always say to all my candidates, it's customized, tailor-made knowledge for that particular task. And what is the role, what is the candidate instruction that is being given to you, or what the role play demands, not like what the task that is being taught in your courses, or even in your previous exam, or in the exam which your friend has attended the same task. She would say, I went to the exam, just they asked me these things, they asked me these questions. This is a common talk among the candidates. But believe me, the same questions may not be repeated. What they asked yesterday may not be repeated today. So don't get panic, don't get stressed out when they come across with a different question. Always, please believe me this fact that take it, it's a 10 minutes task, and try to aim for 9 minutes, try to complete the task for 9 minutes. What I mean with that, when you take the patient simulated patient task, which is for 10 minutes, so keep your agenda fixing within 50 to 55 seconds. The information gathering, let's say history, examination, and investigation, is to 3 to 3.5 minutes. Try to wind up all these things: your history, your examination, and the investigation. Applied clinical knowledge is 4 to 4.5 minutes. So that finishes how many minutes for you? So 3.5 plus 4.5 is 8 plus 1, 9. So you have 9 minutes. You have the last 1 minute. Please give 1 minute for the role player to raise her questions, if at all, if it has not been answered by you previously. And if you don't answer that, unfortunately, your task will not be able to score fully. That's what one of the common mistakes the candidates do. Man, this was just an ectopic pregnancy. I could do this way. But unfortunately, would have gone for a borderline because you didn't have time or you didn't allow her to ask those questions which is given in the script. And if those questions are not answered, how do you expect the examiner to evaluate you? Then how do you expect the same old molar pregnancy or the ectopic pregnancy be a passing task for you? All right? So please understand this. So remember again, more role play talks, more the marks you will gain. I've mentioned here something as customized tailored knowledge. Yes. So we don't expect you to by heart all your guidelines and recite to us. We don't do that because all your knowledge has been already been tested in the part 2 exam, and that's why you're sitting for the part 3 exam. However, if that remember all that 100% that we study for the part 2, we are going to take only 20% of that. That's one of the domains, one of the 5 domains. So that's 20% of your parts. The 80% will be the information gathering, the patient safety, communication with the colleague, and communication with the patient. So this is a totally different platform, a higher platform than what you study for your part 2 exam. So I know some of the candidates who didn't attend any course for the part 1 and for the part 2, but you need to have at least 1 long course and 1 crash course and a couple of mocks, whichever is your choice, either under me or any one of the elementals. It's absolutely up to you. But get yourself familiarized to all this, okay? Self-learning or just doing a task with the study partner will definitely not going to help you out, right? So because it's a totally interactive exam, you definitely need someone to correct you, someone to to guide you, someone to mentor you, and that's why we're all here. The structured discussion, please try to use the S-bar tool. So by this time, you must be aware of what is mean by S-bar, the situation, background, assessment, and recommendation tool, whenever and wherever required, okay? Because that's their communication too. And please, my dear friends, believe me that this is an exam of justification. You ought to justify each and everything, every word that comes out from your mouth. And unless and until you justify it, you will not be scored for that. So you can never ask unwanted, inappropriate questions because you think this is a template. This is the template for the early pregnancy, or this is the template for the gyn-oncology, and I will ask all the questions. Please don't do that. All right, so you need to justify. I know some candidates for likely sclerosis, they will ask, what is your blood group? And do you have any reservations for transfusions? So don't you think it's highly inappropriate to ask? In the nervousness of the exam, I've seen many candidates, the age of the patient will be 21, and they'll be asking, are you updated with the cervical screening? Because it is just like the memory comes. Unfortunately, the plain, simple presence of mind wanes away. No, I don't want any of you to be like that, okay? So cervical screening, yes, it's a national screening program and you ought to ask most of the tasks. However, it should be age specific, isn't that? And whenever you see some high-risk patients, some HIV patient, or immunocompromised, you need to make sure that just not a simple question of asking about, are you updated with your smears? You should tell them that, are you updated with your smears annually? Because we recommend them to do an annual screening, and are they updated? If not, you have to advise them or you have to recommend them to do an annual screening because of the high-risk status. Right, so right from your information gathering, right from your examination list, you cannot just say, I will do this examination, I'll make you lie down, I'll do this, I'll do that. Yes, you can never say that. That's with the exam, you ought to justify why, what you're going to do. I would like to examine you in the presence of a chaperone. The nurse chaperone will be recording the blood pressure and beta height ratio. I'll be having a feel of your tummy. If any masses or any tender, you cannot say tenderness, any painful areas, right? Or any painful areas on touch. Or I would like to have a look at the down below to just check for whatever you're going to say. All right. So please justify. Don't say, I'd like to do a tummy examination, I'd like to do a down below examination, just push on. No. So that means your information gathering will go as a borderline. Also, whenever you do some blood tests, like for example, if you want to do a full blood count, please justify why you're doing it. I want to check your blood counts. I want to check your urine for any bugs of the urine. I want to rule out sugars. So whatever you're going to do, please justify. Unless and until you justify, it's going to be incomplete, because you will think, okay, I have told this that I'll be examining her. I've told that I'll be ordering all these investigations. Unless and until you justify, it's going to remain incomplete and you'll be scored borderline for that. Also, whenever you give some applied knowledge, some management options, please, my friends, always start from the conservative options. Don't just jump, because a safe doctor is the one who's got the differential diagnosis of the mind. A safe doctor is the one who has got a wide holistic approach towards the treatment, and just don't have a narrow-minded approach. For example, suppose let us take this example of a woman coming with the early pregnancy assessment unit. She is having some dizziness and lower tummy pain, and she's bleeding. And then you just take her for the scan, and you find there's a right ectopic pregnancy, which is around, the sac size is around, like I say, 5 centimeters, and there's a live heartbeat. Okay, so your urge is to say that no, you have just only the surgical option. Okay, because you are justified in saying. However, you have to say that your safe doctor is the one who is going to say everything in total, but with proper justification. So now, Sarah, we have 3 options for you. One is the expectant option, where we wait and watch for the pregnancy products, or for the pregnancy to get removed by yourself. Unfortunately, that may not be an option because your pregnancy is advanced. You have the second option called the medical management, where we give an injection with the correct safe. However, this again may not be a suitable option because you have an advanced pregnancy. So the third option is going to be the surgical option. So that should be your communication. That's what makes you a safe, a knowledgeable doctor. Nothing less than that is going to evaluate you. Same way, in the structured discussion, whatever you say, please justify the examiner that I'm saying this because of this, or as part of the talk, if at all, if you can remember any talk or any, most of the guidelines will be able to remember, but the talks it's quite difficult, but always give them evidence-based information. And please justify whatever you're saying. You just cannot, just for example, if you're going to get a woman who's having, let us say, a structured discussion, the very popular Jehovah's Witness and Rh negative blood group, and placenta accreta. So you ought to ask her how far she stays from the home. You ought to ask her what's her fertility wishes. Unless and until you're going to bring all this in the information gathering that you're going to say to the examiner, if you don't ask this, your information gathering will be lost. All right? Very minute things, very minor things only candidates generally tend to overlook, because there is so much of information overloaded in your heads, so that you forget this basic, simple things and will land up in trouble. Right? So please justify, my friends, whatever. If you are in the approach of justifying yourself in whatever you say, I'm damn sure you will definitely not miss anything. So in the structured discussion, time is never a problem. Here again, allow the examiner to ask questions. Don't bombard with informations. Just because you know the guideline thoroughly, or you know this particular task, which you just practice with your study partner a couple of days, just don't get too excited and don't be the urge of, reproducing all the information that you know. So please patiently listen to the examiner of what he's saying, take a pause, and then provide the answer. Okay, it should not be like a computer where you just click some but then immediately the information comes. No, we are human beings. All right. So again, a safe doctor is the one. So you're going to just bombard so much of information. Don't think that you'll be given, say, for example, if the mark is 20, you will not be given 40 marks. No. On the other way, if you're going to say that in a composed manner, with whatever information that you will see and with appropriate justification, definitely it's going to be a passing task. So please allow the examiner to ask questions, listen to them carefully, and then answer the question instead of jumping into something and making this an incomplete task. So the labor ward prioritizations, there are a lot of issues for so many candidates regarding labor ward prioritization. So very soon we'll be having a free session regarding, and this 8 weeks will be every now and then we'll be calling you for some free sessions regarding labor wards, regarding gynae wards, regarding clinical governance. So regarding statistics, so many, the so-called challenging topics, the maternity dashboard. So all those things we'll be calling you every now and then. So please be active in the group. Please post your tasks on time so that we can get feedbacks, as well as you'll be properly guided about all these things. All right. So labor ward prioritization is there will be different sets. So this time it's quite uncertain exactly what they're going to give, but don't worry. In the courses, you'll be given adequate training and adequate, appropriate varieties, in whichever variety you'll be given tasks, you'll be able to clear them with ease. So again, the gynae ward is one of the most favorite tasks of the RCOG. So generally there'll be around 4 to 5, and it will be easy for you to finish the gynae ward on time rather than the late. So
hello? Sorry, yeah. Because I cannot hear. Halas, okay, now clear.
Yeah, okay. All right. Now, having said that, let us just talk a few things about, the last few words that I would like to say about this exam is, right. So please believe me, the total essence is you're expected to be a safe, an empathetic, a knowledgeable, middle grade doctor with a good set of communication skills. Okay, you ought to be a safe doctor. You ought to be a knowledgeable doctor. You ought to be doctor with a good set of communication skills, and you ought to be empathetic, as well as you are a middle grade doctor, meaning to say you will seek guidance from your seniors, from your consultant, from the specialist. So you are the one to seek guidance from them, as well as you'll be able to guide your junior colleagues, teach your junior colleagues, your midwives, give instruction to your juniors in the labor ward. Okay, so this you have to understand and apply it appropriately in all the 5 tasks. So this exam is examining you for your clinical, your managerial, your leadership, and your teaching skills. So out of these 4 skills, at least 3 at a time will be examined. So you just cannot, just say that I can do so many things clinically and then stay off. No, you ought to be a leader. You ought to be a manager. You ought to be a teacher. Okay, so that will make you wholesome as an MRCOG doctor, MRCOG consultant, right? So please practice the tasks with the same concept in the mind. So having said that, let us go for the tasks now. So Nihal, can you do a task to me?
Sorry?
Can you do a task?
Yes, I will do. No problem.
All right. Okay. All right. So let me focus your task. Now. So Nihal, can you see my task?
Yes.
All right. So can you just see the timer also? Let me set the timer for you. Right. So Nihal, my dear, can you see my task? Can you see my timer?
Yes. Yes. Yes.
Yeah, great. Okay. So I will start in 2 minutes now, please.
Can I start?
Yes, Nihal, start, please. Take your 10 minutes now.
Okay. Hello.
Hello.
I'm Dr. Nihal, the doctor in the Urogyn clinic today. May I check your name and age, please?
I'm Gabby Sampson. I'm 36.
What would you like to be called?
Yeah, call me Gabby.
Okay, Gabby, what I understand that you have some problems with your water work. Is that right?
Yeah, that's right.
May I know if you have any other concerns or expectations from our consultation today?
Well, doctor, this is really affecting my quality of life. I need some permanent solution for this.
I'm very sorry to hear that. Don't worry, Gabby. We are all here to help you and support you. Please, Gabby, if you allow me, I want to ask you a few questions to know more about you. Then I will give you some options of management, and I may need to do some examination and some test. How does that sound to you?
Yeah, that sounds great.
Okay, can you tell me more about the symptoms since when it started?
Well, doctor, this is starting around 8:34. Started with a bit of tummy pain down and some discomfort when I weak. So I just go to the doctor. The doctor examined me and gave me some antibiotics, saying that there are some bugs in the urine. After testing the urine, and it was okay for a couple of weeks. Then again, the issue started. So I've got tried with a variety of medications, with some herbal medications also. Nothing seems to work out, doctor. So what is happening to me? And this really, makes me very difficult because I'm in a very responsible post and I work for long hours. So sitting for meetings and attending, sessions, makes worse. Gets worse. So I had to rush to the toilet. I have to take very often toilet breaks.
I'm very sorry to hear that. It must be a very difficult time, Gabby. Gabby, please, can you tell me, do you have any leak of urine before you are
No.
reaching the toilet?
No.
Do you feel that you need to rush to the toilet?
It's a pain, doctor, which is rushing me to the toilet. It's urging me to go to the toilet because once I be down, I'm feeling better.
Oh, okay. Okay. Any change in the color of the urine?
No.
Any blood with the urine?
No.
Any problem opening your bowel?
Not at all.
Okay. Do you feel that this pain is associated with any certain type of food, like spicy food or?
Well, doctor, I take a lot of spicy food and drink a lot of colas because I'm too busy. I work for around 14 to 16 hours a day. So it's quite difficult for me to make anything for myself.
Can you tell me about your drinking habit? Are you drinking a lot of coffee?
I drink around 3 to 4 cups of coffee and around 6 glasses of cola and wine also in between the night.
And how often that you need to go to the toilet in the morning?
I mean, in the daytime, I go around maybe around 6 to 7 times.
Do you feel that you need to wake up at night to go to the toilet?
No, that's just a couple of times.
Any weight loss?
No.
Any problem with your appetite?
No.
Okay. Otherwise, you are fit and well?
Well, that's right. Yeah, I'm good.
What about your period?
My periods are regular.
Are you on any form of contraception?
No.
Did you ever get pregnant before?
Yeah, I have 2 kids and both are normal deliveries.
And what was the mode of delivery?
Normal deliveries.
Okay. Sorry if you find part of my questions personal or intrusive, but I need to ask about your sexual life. Can I proceed?
Yeah, sure, doctor.
Okay. Are you someone now?
Yeah, doctor. I have my partner, my husband.
Did you ever treated for any sexual shared infection, either you or your partner?
No.
Any surgery is done in your tummy, pelvis, or down below?
No.
Okay. Are you on any form of medications?
No, I just used to take on and off some pain relief tablets, nothing else.
Are you allergic to anything known to you?
No.
Are you smoking?
Yeah, I smoke around 20 cigarettes per day.
Are you drinking alcohol?
Yeah, I told you I drink a couple of glasses of wine before night, before getting to bed.
Pardon me to ask, any recreational drugs?
No.
Okay, sorry, Gabi, I never mean to be judgmental about your social life, but my duty as a doctor, and also I don't want to be a paternalistic and to force you for anything, but my duty as a doctor to inform you that smoking and drinking alcohol can affect your life even in a very small amount. So what do you think about that? Do you feel that you want to help to stop?
Is it so, doctor? I'll think over this.
Okay, if you feel that you need some help, I can contact you with a smoking cessation center. So they can help you to stop smoking. They will offer you some nicotine patches or some tricks to help you to stop smoking. How does that sound to you?
Okay, that sounds fine. Yeah.
What do you do for a living?
Well, doctor, I'm a chief accountant in a multinational company.
And with whom you are living?
With my partner and kids.
Okay. Do you feel that you are safe and well supported at home?
Yeah, that's true.
Okay, thank you for giving me this valuable information. Do you want to add any more points, Gab?
Nothing, doctor. I just need to, get rid of this thing.
Okay, Gabi, from your history, as you told me that you feel some pain in your lower tummy, and this pain is subsided after you are passing urine. We suspect that you may have a condition, what we call it, bladder pain syndrome. Did you ever hear about it?
What does that mean, doctor?
This is a problem with the water pack. I will not say a problem, but sometimes you feel pain with the water pack. This pain can be relieved after you pass urine. Still, the exact cause of this one is not known, but they thought that this may be some lacerations or some abnormalities in the cells lining the internal part of the water pack. And whenever the urine is there, it's making some irritation. So can cause such a kind of pain. Am I clear to you?
Oh, really?
And also it can be linked to some kind of foods like spicy foods, or sometimes can be linked to drinking alcohol, or sometimes the exact cause will not known. Am I clear to you?
Oh, okay.
Okay, Gabby, for that, I want you to keep a urine diary, which I need you to document for me how many, what kind of drinks that you are drinking, and what is the frequency, and what is the amount, and also how many times that you are going to the toilet, and when you have the pain. This will be for 3 days. And also I want you to keep for me a food diary. So I want you to write for me what kind of food that you are eating. And I want you to link this with the pain, if you feel some pain with some kind of food, so we can understand what is the link between this pain and this kind of foods. Am I clear to you?
Yeah, you're clear, doctor.
Okay, in the meantime, this is very good from your GB doctor that he start you on antibiotic and he treat any kind of infection. So we thought that this may not be the cause. Now, so we will go a step forward. Now I want you to keep some measures, like I want you to modify your life. So we need to stop smoking, we need to stop alcohol, and to do some regular exercise, and to avoid some stress, which can be, I know it's very difficult to avoid stress in your job, but still we can help you in that. How does this sound to you?
Yeah, doctor, that sounds great. Yeah.
Also, there is some techniques that are like yoga and some relaxation technique. It can help you to relieve from this stress and can help you with this pain. In case of this measures is not working with you, and after we saw that these diaries, we can go a step forward and we can start you with some medications. These medications, to be honest with you, is licensed for is anti-anxiolytic medications and licensed for the treatment of depression. But also some women, they may feel a good relief with when using this medication. Am I clear to you?
Okay.
Also, I will contact you with a counselor. They can speak to you and help you to cope with such a condition. And also, as I told you, they can give you some techniques to relieve the stress. In case if this is not working, so a group of specialists will now look into your case. And in the meantime, I will speak to my consultant about your case. But at that time, a group of specialists in higher center will look into the case. They may need to do some injections in the water bag itself. So we can discuss this with you later. How does that sound to you?
Okay.
Okay, now Gabi, I will speak to my consultant about your case, and I will give you patient information leaflet, and I will add you to some support group. And I want you to keep the fluid and food diary. How does that sound to you?
That sounds great.
Okay, and also I will write back to your GD. Thank you for your time.
Thank you, doctor. Thank you, Nihal. Very good opening. Very good opening. All right. So you're Michael. So you know how you have to speak your introduction. You've been taught in the courses how you have to get introduced and how you should do the counseling for the smoking and how you should communicate with the patient. So this bladder pain syndrome is one of the time challenging tasks. So it's not difficult to diagnose what is this task, Stephen, but it's difficult to, try to finish that. So I was very happy when you could do that. You're almost at the finishing, right? So again, certain things, however, have to be improved. So when I taught you about counseling, I asked you to mention the specific reason of why you have to stop. Because smoking and sometimes the spicy food or the alcohol, they might irritate the bladder because as they produce some toxic chemicals that might irritate the bladder, the inner lining of the bladder, which might make the condition worse. So you told her that this is not good for you, but you have to justify it. This is an example of justification. So when you do the counseling for smoking, you ought to say her the smoking and spicy food and the colas and all this alcohol, the wine and all, they release some toxic chemicals which might irritate the inner lining of the bladder and which might make the condition worse. All right. So here you have a woman, you have a 36-year-old, very busy professional who's having this condition. Still, you ought to be empathetic. You ought to be. Congrats, Sidra, that's great to know. Right. So you ought to be you know, clear in and justify yourself in whatever you are speaking. All right. So this is one of the diagnoses of exclusion, and we have to ask so many questions to say that this is not this one. And always, in such cases, so I always say to all my candidates, a safe doctor is the one who's got differential diagnosis in the mind, and you have to show the examiner that you are a safe doctor, you are a knowledgeable doctor. We're asking those questions which are related as a differential diagnosis. Okay, you know very well that this is a bladder pain syndrome. However, you ought to ask questions which is related to the pain. So it could be a chronic pelvic pain, it could be an endometriosis, it could be a previous history of abuse, it could be a
Yes.
child experience. So you ought to differentiate that. Okay? You just cannot have a closed approach, just saying, oh, this is bladder pain syndrome and I will speak. So that's where the things go wrong. Unfortunately, that's where the candidates tend to lose the mark. So please remember this fact that you have to show that difference well in the beginning in your information gathering through and through till your examination and diagnosis and investigations and till the management options. All right. So yes, and most of these cases, please ask mental health question. All right, especially these cases, these women with some pain, with some issues, where you talk about stress relief, you talk about some yoga, you talk about so many CBT and other things. Please remember to ask mental health. And my dear Nihal, you missed that.
Yes.
So please ask. So just don't skip that. Don't think only for or antenatal cases or only for obstetric cases that develop mental health. No, there are so many women having some issues like so. Every basis, every task, whether it be obstetrics, let it be gynae, let it be self-fertility, you ought to ask a mental health status and a support at home, which can never affect a risk and allergies, of course. All right, so these are the few things that you ought to work on. I was happy that you could do that within nearly almost 10 minutes and a few seconds extra, but try to finish that within 10 minutes, and that comes with the fluency. So your fluency is good and your knowledge is good, except that you missed a couple of things. So most of the other things was done.
But if I told all these things, that I think the time will not be enough. Yes.
No. Your time is enough. You were just taking a few seconds more. Your time is sufficient. You could do that. Yeah, so keep, practice more many times so that you'll be able to bite that. At least because I know European stations are time challenging stations. At least you should be finishing just before the 10 minutes. Okay, maybe 9 minutes and 45 seconds or 9 minutes and 50 seconds. All right. So try to practice that very hard. So we have the session on neurogynae for you in this coming Saturday. All right. So thank you, Nihal, and let me have with me.
So it will be borderline or pass station.
Yeah, it was a good attempt. It was a passing station, but as you are aware that I'm a good as a friend outside the session, but as a mentor when I give review, I'm very strict. So it's a passing task, but still I want you to improve on all these things that I told you. All right, and your time also. All right. Thank you, Neha. So I'd like to take Aishwarya with me. Yeah, thank you. Please, Aishwarya, could you please open up your mic and are you ready for the next task, please?
Yes, ma'am.
All right. So you're going for a face-to-face exam. So it's in Kolkata or in Chennai, my dear?
No, I've mailed them, ma'am. I'm getting that automated reply only, so I don't know. But the payment has went through the card, so I'm not very sure, ma'am.
Did you get the confirmation mail from the RCVG?
No, ma'am.
Okay, so yeah.
If they took the payment, they will reply even sometimes after 1 hour.
Sometimes after 1 hour,
okay.
After even the next day, the next working day, because there's a lot of people which sometimes their mails don't reach on time and so many things. So don't worry. So once you made the payment and once the amount is got deducted, so that itself is evidence that that RCVG has taken your slot. Okay, has granted you the slot. Okay, that's great. So you can tomorrow morning you can write a mail to the RCVG and to the finance department, the exams department and the finance department, showing the screenshot of your transaction, asking for a confirmation. Yeah, that thing you can do. You have to mail to both the departments, the exam department as well as the finance department. You can just find it on the website, necessary the mail links. All right. But just let me know, I can post it for you also. It's already available with you guys, right? So let me go for the next task, please. Right, so I should just give me 1 more minute for me to open up. So can you see the task, Aishwarya?
No, ma'am, it's a blank screen still.
No?
No.
Can you see the task now?
No, ma'am.
Well, now is it so?
It's the same, ma'am. One blank screen is coming.
Can you see task number 3? Yes, can you see task
Yes,
number
yes.
3?
It's trying to clear up, ma'am. I can't see anything.
Already shared it. Can anyone of you see the task number 3?
I can't see, ma'am.
Can anyone else see?
I'm able to see, ma'am.
Oh.
Yes, Dr.
Yeah,
Vanika.
we see it, ma'am.
Okay. You're saying, I think something wrong with your system, Aishwarya, with the internet. All right.
But I'll just retry.
All right, okay. So no worries, you just make everything right. In the meantime, I can give the task to someone else. Dr. Prasanna, are you ready for the task, my dear? Dr. Prasanna, are you ready for the task?
Ma'am, can I take next task, ma'am? I'm in one procedure, ma'am. Just I'm
Sure,
putting the
sure, sure.
Bluetooth.
No worries, no worries, no worries. Thank you.
Thank you.
Right. So I
You
would
can
like,
just read out. I'll take this task, ma'am.
sorry,
If you can read out, I'll take it. I'll take this task, ma'am. If you can.
Aishwarya? Okay. Just try to, because others are able to see. That's just the benefit for everybody to see the task, isn't that, my dear? So just try to, log in and log out so that
Okay,
you'll be able to see, all right? So I'll give you the next task, don't worry.
Okay. Okay.
So I would like to take Sania for this. Sania, my dear, can you see the task? Sania, my dear, could you please? Can you unmute yourself, Sania?
Yes, ma'am. I can hear you.
Right, great. So are you ready for the task? Are you able to see my screen?
Ma'am, after 2 minutes.
All right. So rest
Okay,
then.
ma'am.
No worries, no worries. All right. Purnima, can you take this task?
Yes, ma'am.
Okay. Are you able to see my screen?
Task 2 I can see, but task 3 I'm not able to see.
Task 3. Can you see task 3?
No.
Can you see the task?
No, now I'm able to see. This task I can see.
Great. Okay. You're going for the face-to-face exam, right?
Yes, ma'am.
Great. Okay. I will start in 2 minutes, my dear. I will not show you the timer, but you can hear the buzzer. Okay.
Okay.
Yeah. So I will start your 2 minutes, my dear. Here's your 2 minutes. Start, please.
Hello, I'm Dr. Purnima. May I confirm your name and age, please?
Hi, doctor. I'm Susie Robson. I'm 29.
Or would you like me to call you?
Yeah, please call me Susie.
Okay. Susie, I can see that you are here to discuss that you had some pain and along with that some lump down below. Is it correct?
Well, that's right, doctor.
Okay. Anything else you want to discuss from today's consultation?
No, doctor. Actually, me and my partner, we plan to have one more baby. So I just want to make sure that I'm fit enough to have another delivery.
Okay. So, Susie, we are here to help and support you. Before that, is it okay to ask you a few questions to know more about you?
Yeah, sure.
Okay. Can you tell me more about your problem?
Well, doctor, this initially around maybe a year before, I was feeling a sort of heaviness in the lower tummy. And then I started to feel some sort of dragging sort of pain. And then initially, and then slowly, I could see that there's something coming from my down below. And it's really affecting my quality of life, doctor. Sometimes it is causing me discomfort when I meet my partner. It's causing trouble in my intimate life also.
I'm sorry, Susie, you're going through a lot and it has affected your sexual life as well.
It's okay, doctor. Thank you.
Yeah. Can you tell me like about your water works?
Well, doctor, there's a bit of stringy feeling when I wee, as well as I feel that this is some I feel that some droplets of droplets also coming out of urine also come out. I feel that I'm not complete after weeing.
Okay. Do you leak or wet yourself while you cough?
No, doctor.
Okay. And do you need to rush to the bathroom to wee?
No.
Okay. Okay. So do you leak anytime before reaching the bathroom, toilet?
Not every time, doctor, but sometimes it does happen also.
Okay. And yeah, you said that you were not able to feel complete even after weeing. Is it right?
Doctor, could you please repeat what you have said?
Yeah, sorry. So before, when you stand up after finishing, you said that you are feeling that you are not past the urine completely, right?
Yeah, that's right. Yeah, that's right. I feel a few droplets of urine still remain and they come out.
So, okay. And can you tell me a bit more about your swelling? Does it decreases or does it increases anytime?
Yeah, actually, doctor, after I weed on, I feel there's a bulge. This is what is happening.
Okay. And it doesn't decreases, right? It remains the same, something like that. You want me to say?
As I told you in the beginning, it was like heaviness. Then something started to come out as such.
Okay. Any back pain? Any pain at the end of the day?
Not really a pain to say, but I would score 3 for that. Sort of a vague dragging pain in the back.
Okay. So can you tell me more about your periods?
Periods are regular, doctor. My last menstrual period was 10 days before.
Okay. And so you're trying for pregnancy. And what about your smear? Are you updated with your smear?
Well, that's right, yeah.
Yeah. And do you follow your GP for any condition?
No.
Okay. And do you have any allergies?
No.
Okay. And any operations on your tummy or down below?
No, doctor.
And any family history of concerns that you want to share about?
Beg your pardon, doctor?
Like clots, any family history of clots?
No.
Okay. Do you smoke?
No, I don't.
Do you take alcohol?
No.
Any recreational drugs?
Not at all.
Are we supported home?
Yeah, he's very supportive, my partner.
Oh, nice to know. And are you aware of your weight to height ratio?
That is 29.
Okay. And have you felt low down, depressed? I know that it's affecting your quality of life after talking to you in a while. So have you met any counselors? How are you coping with the situation?
Yeah, doctor, my GP has already sent me to the counselor, and the counselor is actually helping me to de-stress myself.
Okay. Would you like to add anything else, Susie?
No.
Okay, thank you for sharing all this information. So, Susie, I would like to offer you examination in the presence of chaperone, of course, with your consent, to see whether painful areas in your tummy and also down below to see whether you leak or leak while you cough. Will that be okay?
Okay.
Okay, I'll be gentle as much as possible. And
okay.
yeah, and I can see that you said that you noticed bulge while being any urine. Did you notice any blood in the urine?
No.
Any fever on and off? And have you been tested for any water infection?
Yeah.
Have you been tested for any water infections before?
No.
Okay, fine. So I'll be sending the urine to see whether there is any water infection. Okay, and also would like to do some tests like a scan to see how much there is urine in the bladder after UV. Okay, and also I'd like to send for a full blood count to see whether there is any infection in the body. Okay, and
okay,
am I clear so far? So, see, do you have any questions?
No.
So, after gathering information from your complaints and also examination, I can understand that you are mostly having a condition called as urethral diverticulum. Have you heard about this before?
No, doctor.
Okay, so this is a condition where this is an outpoaching from the water pipe. As this is related to an water pipe, there is the small glands will be there along the water pipe, and this gets blocked due to infection. As a result, the urine gets collected and you can see the bulge. Am I clear?
Oh, okay.
Yeah. So so whenever it gets blocked, you get pain. Okay.
Doctor, so what sort of a treatment? Can I take some medicines for this bulge to become all right?
Yeah, what we can do is we can offer you medication as well as other option surgery. The medication will temporarily, your symptoms will get reduced, but this keeps on coming as there is an outpoaching. So in long term, there can be a side effects like you can have a stones, and I'm just sorry to say that I'm not here to scare you. This can, in long term, can turn into cancer due to chronic changes. I mean, long term changes. Am I clear so far? Also, do you have any questions?
Doctor, we are planning for a pregnancy. So how far that I will be all right to have a pregnancy?
I need to refer you to the urologist, that is a specialized doctor. So I don't think so that this will affect your affect your fertility, that is chance of getting pregnant. Okay.
Okay.
Okay. So the permanent solution would be an operation. So where they will excise this outpoaching. Okay. But this would needs an expertise, as this is an area of delicate area, need to be tackled by specialists. So I'll be referring you to them. They would may offer further tests to confirm the diagnosis. Okay.
All right.
Am I good? Okay. And the operation involves removal of that swelling. And in case if there is any, these tends to come back. So in that case, an operation will be done like vascularization or de-roofing of the sac. So it is you will be provided with the patient information, written information regarding that in the further consultation to know more about that. Okay, am I clear so far?
All right.
And also I'll be informing this to my consultant. So do you have any questions?
No, doctor.
Okay. So I'll be documenting whatever we have discussed, provide you the written information regarding this condition, and also provide you the support lines. And thank you, Susie. Thank you for your time. Do you have any questions?
Thank you, doctor. Right. So a good attempt. You know what is the task? See, whenever you give the information, please give in chunks. Involve the role player. Am I clear so far? Any questions? Don't ask all the questions. You asked me about any questions for me, which I had a couple of questions with it. But since you went on and on, I couldn't interrupt you. So they will not interrupt you in the exam also. So just ask her, am I clear so far? Any questions for me? Am I making sense? Any questions for me? So that would be a better way of.
Sorry, any questions?
Any questions for me?
Okay.
So if at all, if there's any question in the script, she will ask you and you will be scored for that.
Okay.
This is why we allow the role player to speak. Okay, you are going to ask me about the questions at the end. At the 10th minute, I have to go out of the room, so I cannot stay inside the room to answer your questions. Right? So you should ask me questions whenever you allow me to ask me the questions that is there in the script, which will fetch you the mark. Okay? So this is what we said. Try to finish the last 9 minutes and try to give at least the last 1 minute, for the role play to come up.
No need. No need to ask me. Like, am I clear? Is enough, no? Like, no need
you
to ask.
Am I clear so far? Any questions? Any questions do you have? Right. So if it is a question, she will ask you, and you can score. Right. Great. Right. So introduction, confirmation of purpose, agenda fixing. Here you'll be asking about the presenting complaints, the onset, the duration, the discharge, whether she's got any discharge and pressing, any test taken so far, any treatment taken so far, any swelling which gets worse at the end of the day, and whether she's comfortable after rest, about the frequency, the urgency, the leak, voiding, the post-micturition symptoms, dribbling, any burning, blood in the urine, any painful sex, bowel and quality of life. Gynec history is the menstrual history, the smears and the contraception. Obstetric history about any difficult childbirth that she had, medical history, medications that she's taking, any allergies, and ask her whether she has undergone any operations for specifically SUI. All right, just operations down below may not suffice. So ask about any operations from the down below, especially for any urinary problems. And did she take any injections for SUI? Family history is the main question. Smoking, alcohol, drugs, occupation support fluids, very important fluids about domestic violence and BMI. Always keep the differential diagnosis in the mind. Diverticum, the cyst, the vaginal cyst. Try to summarize at the end. So remember, the symptoms of the urethral diverticum include dysuria, painful and burning urination, dribbling, urinary leakage after urinating, dyspareunia, painful sexual intercourse. Upper knowledge is a condition which is a pocket or outputching, which forms next to the urethra. There is a water pipe. Because it most often connects with the urethra. This outpouching repeatedly gets filled with the urine during the act of urination, thus causing the symptom. So wait and watch policy is not a possible option for you because it's not a possible option. There's no any medication to treat you. The only option that is there is the surgical option, that is the anti-NMPT and the consultant, including the urologist. So we'll be making a cut to the sac neck, or we'll be creating a permanent opening of the sac in the vagina. We'll be removing the sac completely. The benefits are that the problem gets discussed that there could be bugs in the urine, there could be some leakage, there could be a relapse of this condition, there could be a false pulsage formation that's called a fistula. If she's not getting treated, she might develop urinary tract infection again, bugs, the urine stones in the kidney, and leaks can occur, and very rarely this could be turns even sinister. So always close with the patient information and support. So any doubts in this, Purnima, or to anyone else?
No, ma'am, no doubts. Like, do we need to say about the complications, like not treated?
Yes, you have to tell her. This is tendency that this might change sinister, that is given in the recommendations, the talk. So please, you have to tell her that it might change sinister at a later date if it is left untreated. Very important. Patient safety. Yeah, very important patient safety point of view. All right. Right. So yeah. So Ashwini, are you back? Are you back and ready for the task?
Yes, ma'am. Yes, ma'am.
Great. Okay.
Hi, doctor.
Hi, Dr. Salma.
Sorry, I was busy with this, trying to book appointment.
No worries.
I called RCUG also,
Okay.
so struggling till now. So that's why I was trying to join. Just
could you make it or not?
Sorry.
Could you make it? Could you get us?
No, they told they will inform us. They will inform.
They will inform you. All right. Okay.
For reopening. Yeah.
All right. So don't worry. Let us hope and pray for the best.
Yeah, I request you that I'll present any case. So I don't know.
There are already 2 in the list, and we already done 2 tasks. So don't worry, we'll be having every now and then we'll be having a lot of free sessions. And there even if not today, don't worry. We will always give you the next time always. All right. So because I have 2 the girls already there waiting.
Okay.
Yeah. Okay. Thank you so much for understanding, my dear. Right. So
Thank
next time you can join well before time, and you can do even the first or the second task. Thank you, my dear Salma. Right. So Aishwarya, are you ready for the next task, my dear?
Yes, ma'am.
Great. I'll focus your task now. So Aishwarya, could you see the task here, please?
Yes, ma'am.
Right. So yeah. And that's not a task. All right. Let us take this task, please. So I will start you 2 minutes, Aishwarya. Can you see the task?
Yes, ma'am.
Great. Okay. I will let me see how we do this task. You can't see my task?
Ma'am, the task changed, ma'am. Like it was different previous one.
Can you see task number 2?
This one I can see, ma'am.
Okay.
Previous one was a different, ma'am.
No, this is your
One.
task. No, this is your task.
Okay. Okay, ma'am.
Yeah. Okay, I'll start in 2 minutes, Aishwarya. Yeah. Take it 2 minutes.
Yes.
Yeah, start, please.
Yes. Hello, I'm Dr. Aishwarya in the antenatal clinic. May I please check your name and age?
I'm Melinda Wilson, 36.
And how would you like me to call you?
Yeah, call me Melinda.
Hello, Melinda. Please call me as Aishwarya.
Thank you, doctor.
Melinda, I see that you're 32 weeks into your second pregnancy, and you're here to discuss more about your birth plan.
Well, that's right.
Surely, Melinda. And at the outset, let me tell you that every woman has a choice to decide on the place and the mode of her delivery. So we are here only to give you all the information, and whatever choice you make will be respected by us.
That's great, doctor.
Melinda, can you tell me more about how your pregnancy has been so far, and more about it?
Well, doctor, this is my second pregnancy, and I'm now 32 weeks, and my previous pregnancy was by a cesarean section. I never want to have anything of that sort this time. I prefer to go for a home birth.
Surely we respect your concern, Melinda, and we would try to be of maximum. We would try to make this delivery as safe as possible for you. And Melinda, so how your pregnancy has been so far?
Well, doctor, everything has been fine so far. All my booking bloods, my dating scan, my 20-week scan, all my bloods, everything has been fine. And John is doing absolutely happy, sad, and kicking happily.
That's good to know, Melinda, and that's a very nice name, John. And Melinda, can you tell me more about how much about your previous pregnancy?
Well, doctor, my previous pregnancy, Sarah was born by cesarean section, and everything was been fine. And Sarah is a very cooperative and beautiful child, staying inside and kicking happily. It was a completely low risk pregnancy, and when I got into trains, I went to the midwifery unit, and then everything went on well until one point of time that they told that there are some concerns with Sarah's heartbeat because Sarah opened up her bowels inside my tummy, and they just switched me to the labor ward. And then the doctors, they were just trying to, talk to me, and there were a lot of rush in the labor ward, and I wasn't given proper information. And it was like in a hurry. They took me to the operation. They cut open me. They took Sarah, and thankfully Sarah was doing fine. But doctor, it took a long time for me to recover out of this trauma. I just don't want to have any such experience this time. So I plan to have a delivery, a home delivery, in the presence of my family members and team.
I'm sorry, Melinda, that it was a difficult time for you, and that you had to go through a lot. But let me tell you that every pregnancy and every labor and childbirth is different. So please be open about I'm here to say all the information to you, and so whatever you choose, we will respect you. So can I know, Melinda, about your future pregnancy plans?
Yeah, doctor, I plan to have at least another 2 more kids.
Okay, and Melinda, if with your permission, I would like to review your previous delivery notes as well.
Yeah, that's okay, doctor.
Melinda, how far do you stay from the hospital?
It is around 30 minutes drive from the hospital.
Okay, sure, Melinda. And Melinda, any other concerns for which you're seeing your GP for?
No.
And any surgeries on your tummy or down below apart from the cesarean section previously?
No.
And how far is it since you had the cesarean section, Melinda?
Now it's 3 years done.
And how was your recovery after the surgery?
Yeah, the surgery was, the recovery is okay, but it took a long time for me to, mentally accept this and try to, cope up with the things later on.
Yeah, surely, Melinda, it must be a difficult time. If you require, I would like to connect you to the counselor as well, and talking to a professional may help you to come out of this difficult memories.
It's okay, doctor. Thank you.
Melinda, can you tell me any family history of concern or clots?
No.
Any allergies for any medications?
No.
And apart from the routine pregnancy vitamins, are you taking any other drugs? Any other
No.
medications?
No.
And any personal habits of smoking?
Nothing, doctor.
Alcohol?
No.
Pardon me to ask, any recreational drugs?
Not at all.
Are you aware of your height to weight ratio?
I'm not exactly sure, but I think it's about 28.
Okay, and about your blood group?
A positive.
Any concerns for transfusion if at all required?
No, doctor.
Okay, and do you feel safe and well supported at home?
Yeah.
Okay, Melinda, thank you for giving me all the information. Do you want to add in something in this?
No, doctor.
So Melinda, if you can allow me, I'll quickly examine you with the chaperone. I'll see your temperature, blood pressure, and we'll see how the baby is growing inside your tummy, and we'll hear the baby's heartbeat as well. So Melinda, thank you for providing me all the information, and I really appreciate that your want of having a home birth. Delivering in the comfort of the home with all the near and dear ones around you is really a comforting feeling, and I really appreciate your thoughts. However, I do have some concerns with you, Melinda. Do you want me to proceed?
Okay, doctor, let me know. What is that?
Yes, Melinda. Thank you for listening to me. So, Melinda, three uh, uh, 3 out of 4 women who are planning to have a normal delivery out of after a vaginal birth will have a normal vaginal will be successful in having a vaginal birth. But however, there is a chance that 4 in 10 women we may require to do an emergency cesarean section because there is a chance that the previous scar may give away, which we call as scar rupture in 2 in 100 women. This will be a life-threatening, life-risking situation, Melinda, where we need to immediately shift you to the hospital and would require advanced medical care for you.
Oh, really, doctor?
Yeah, and
But doctor, I
Melinda,
don't want to go back to that, go back to the same situation.
I'm sorry that the communication was at fault in the last delivery, Melinda. This time I will try to communicate you in a better manner, and we'll try to update you with every step so that you are well informed of the things that are happening, and we'll make it a pleasant experience for you. However, we want this delivery to be a safe journey for you and your baby. So we might lose some important minutes for you or your baby in getting you transferred from the home to the hospital. That is the reason we want you to consider delivering here at the consultant led care, where me and my team of doctors are here to help you.
Okay, doctor.
So Melinda, from now on, like a team of doctors would be taking care of you, me, my consultant, the specialized midwife, and the pain relief doctor would be looking at you around 36 weeks, and also the baby doctor as well. We'll plan your delivery around the 36 weeks and we'll aim for a vaginal birth. And I'll book your, and we'll give you all the support after the delivery as well. By closely, during the delivery, we'll continuously monitor the baby's heart tracings and also would be continuously taking care of you as well, and we'll try to communicate to you things in a better manner. And Belinda, do you have some other concerns which you want me to address?
No, doctor.
So thank you for thank you for letting me talk, Melinda. And I'll give you all the information in the form of a leaflet. Would connect you to the support groups as well. There is no need to take this decision right now, Melinda. You can come again with your partner, and I'll arrange another meeting in 2 weeks' time with my consultant, and then you can tell me about your decision.
All right.
Thank you, Melinda.
Thank you, doctor. Thank you, Aishwarya. You got 20 seconds more. 20 seconds left out. So that's a good thing that you did it. Well done. So your approach, your introduction, your agenda fixing, your information gathering, your applied knowledge was good. It's a well done task. However, a few things that you ought to realize here is she has got a bad experience at a hospital. Maybe this time you can counsel her to go to another hospital. Right? So there are two things that you'll be counseling. One is home birth versus hospital birth, and VBAC versus elective repeat cesarean section.
Okay, yeah. Okay.
Yeah. So that's your task. So you'll have to cover that in total, just not about home birth and hospital birth alone will not suffice. So introduction, information discussions, agenda fixing, concerns and expectations. Ask the details about the present history. So whenever she says something, says that, I'm sorry, you told, but when you say that's a concern, you have to just, yes, your concerns are valid.
Okay.
So that should be a statement. So that's whatever may be, like that be a mark of your notice or an acknowledgement. Okay, just say, don't say and then proceed on. Okay. So yeah, you have to say yes, your concerns are valid, and I'm here to address all your concerns. Before that, will that be okay to ask a few questions to know more details about you? Such that should be your opening up. Okay, so whenever she's, let that be any damn thing under the we don't care. Let that be even a sick note. Okay, even let that be any small thing. Just say that your concerns are valid. That should be a communication. Right. So obstetric history is the present details about how the pregnancy, so the folic acid, the vitamin, the Down syndrome screening, the baby's names and movements and everything that she told you. Ask about the future fertility plans. Yes, very good. And how far she stays from the hospital, excellent. And gynecology routine questions, medical, surgical, the blood group and family history and alcohol and drugs and mental health and support and BMI, yes. So high risk pregnancy, she has to deliver in a hospital care, consult with unit, counsel the board of the birth, explain the risk to the mom and the baby, explain the risk protection that you did. MPT, wherever you want to, involve your colleagues, your baby doctor, the anesthesia doctor, the specialist midwife, the specialist nurse, please bring them into the scene. So no need to decide, address your concerns, close with a follow-up and referral, right back to the GP of the midwife, safety advice, if any, red flag signs, if any, 24/7 contact numbers, patient information, if and support. Okay?
Okay.
So any doubts for anyone else? Any doubts for Aishwarya or anybody else?
Excuse me, can I ask?
Yes, please. Yes, please, Salma. Yes, my dear.
Yeah. Yeah, so do you think that we'll explain the home birth and that means the advantage, what she want, advantage and disadvantage, then the hospital birth also, that advantage and disadvantage, then cesarean section also we have to explain?
Yeah. You ought to explain both home birth versus hospital birth, VBAC versus elective repeat section.
Sorry, your voice is not clear.
Yeah,
So
so
that's
you
why I
ought
make
to,
it.
yeah, I'll repeat. You
Sorry.
ought to explain home birth versus hospital birth, as well as elective repeat section versus VBAC versus elective repeat cesarean section.
Okay, thank you.
Yeah.
Thank you very much.
Welcome.
Then,
Welcome, my dear.
doctor, can
Yeah.
you because I missed the previous two session, first one or second one.
Oh,
Can
no
you
worries.
share the slide, please? Can you see?
Definitely we'll share you with
Thank
the
you very much.
recording and
Thank
you can, yeah.
No,
that will be-
slide, only the slide. Can you show?
No, the slides will be with the, I'll try to focus, that will be with the moderator. I'll try to focus, by the recordings, I can post you the YouTube and you can just listen to the recordings, yeah? YouTube
Okay, thank you.
Thank you so
Yeah.
much.
Thank you. Thank you.
Thank you. So Dr. Prasanna, are you available now?
Yes, ma'am.
Right, okay, right. So let us do one task. All right, so can you see the task now, my dear?
Yes.
Okay, so at the end of 2 minutes, you'll hear a buzzer, and at the end of the 10th minute, again, you'll be hearing a buzzer. The timer will not be in front of you because you guys have to do a face-to-face exam, so we have to train you for that. Right, so I'll start you 2 minutes, and there are 2 slides in this, my dear.
Yes, ma'am.
All right. Your time has started.
Yes, ma'am. Yes, ma'am.
There are only 2 slides.
Okay, ma'am. First slide, ma'am.
Yeah. Right, start please. Your 10
Yes.
minutes is starting.
Yes. Hello, I'm Dr. Prasanna, one of the doctors in the gynae clinic today. May I check your name and age, please?
Hi, Dr. Andrea. I'm 21.
How would you like to be called?
Yeah, call me Andrea.
Okay, Andrea, I gathered information from your GP note. You having some swelling in your tummy. You are here to discuss about that and investigation report. Am I right?
Yeah, that's right.
Andrea, I'll address all your concerns in a few moments. Before that, I need to ask you a few questions to know about you. Then I can examine you in presence of chaperone. Then we can make a mutually agreeable plan. How that sounds to you?
That sounds great, doctor. But the GP has already examined me and ordered some tests. I'm here to discuss the reports of the same.
Okay, Andrea. Okay, I won't examine you. Yeah, just I'll go through the GP finding.
Okay, doctor.
Andrea, could you tell me more about your problem?
Well, doctor, it started a month ago, sort of a weak lower tummy pain and a bit of pain in the back as well. And I tried a variety of painkillers, including Brufen, but nothing seemed to work out. So I just go to the GP. The GP examined me and she ordered for some tests and the scan report. So just let me know what's happening, doctor.
Okay, Andrea. Andrea, this is my first time I'm meeting you. I need to know you to make some questions to ask you. If I go with the report, or I can ask you a few questions to know about you.
That's okay, doctor. You can ask me questions.
Okay, fine. Andrea, do you have any vomiting or any tummy pain at present?
No.
Okay. Do you feel dizzy?
No.
Do you have any problem with your water work and bowel work?
Nothing, doctor, at the moment.
Okay. Can you tell me more about your periods?
My periods are regular, doctor. My last menstruation was just 2 weeks ago.
Okay. Do you have any pain during your periods?
No, just like the moderate pain that I usually get.
Okay. Pardon me to ask you. Some of my questions are intrusive, but it's very important for the management. Are you sexually active?
Well, that's right. I have a partner.
Okay. Have you and your partner ever treated for sexually shared infection?
No, doctor.
Do you have any abnormal discharge from down below?
No.
Are you on any form of contraception?
Nothing at the moment.
Okay. Otherwise, you are fit and healthy?
Yeah, that's right.
Okay. Are you underwent any surgery in your tummy or down below?
No.
Do you drink?
I don't.
Do you smoke?
No.
Pardon me to ask you, or any recreational drug?
No, doctor.
Any family history of concerns? Any family history of cancers in the womb or colon or in the ovary or breast?
No, doctor.
Any family or personal history of clot?
No.
Okay. Whom do you live with?
Well, I live in the hostel, doctor. I'm the university. So I live with my friends.
Okay. What are you doing?
Well, I'm a research scholar, doctor.
Okay. Okay, fine. And yeah, are you feel down or depressed in last few weeks?
No, okay.
Okay. Thank you, Andrea, for sharing all the information. Would you like to add anything?
Nothing at the moment.
Andrea, I can from your history and this examination finding provided with me, and I confirmed your name, NHS number in your blood test and scan report. I'm having some concerning news to discuss with you. I can see you are alone today. Would you like somebody to accompany you?
No, doctor. It's okay. Tell me.
Andrea, from the scan, your blood test, some of the blood tests seems to be normal. That is some protein substance they check. Some of the protein substance is normal, and out of four thing, the one protein substance in your blood is elevated. That is 250. That means this protein is sometimes sometimes even it is elevated in the non-sinister changes condition also, and sometimes it is elevated in the sinister changes in the tummy also. And scan also showed there is a large fluid-filled sac-like structure in the ovary. That is called a cyst.
Is it something sinister, doctor?
No, at this moment it's very difficult to say, but the futures of the cyst on looking on the scan look more of non-sinister changes.
Okay.
Okay, and anyway, I will involve my consultant and this team of doctor in your care. And Andrea, are you following me?
Well, that's right. Yeah.
Am I clear so far?
Yes, doctor.
Okay. Do you have any other questions so far?
No, doctor.
Okay. Coming to this management options, seemingly the cyst was the fluid-filled sac called cyst. This cyst was very bigger in size. And as per our the NHS recommendations, this much size cyst usually need a removal because this much cyst sometimes may undergo some cyst accident. That is, sometimes the cyst will twist around its the origin. Sometimes because of this twisting, sometimes the blood supply to the cyst, that means the ovary cut off. So sometimes we may lose the ovaries also.
Doctor, I have my exam the next week. Could you just give me some tablets to swallow so that I can, come back after the exam, maybe in the next month?
Yeah, Andrea, I understand your concerns, and definitely we will talk to the university. We can give you a sick note also, because sometimes this much big cyst sometimes undergo this torsion, sometimes cyst may rupture also. If it is rupture, I'm not scaring you, Andrea. Sometimes it may land up with life-threatening emergency for you.
Oh,
And,
doctor.
yeah, Andrea.
Exams.
Yeah, we will write to our university exam department regarding your conditions, and we will give you the sick notes also. And because this much cyst, sometimes we may lose your ovaries also, but even single ovary is enough for future fertility, but losing the ovary and this sometimes may decline your fertility potential also in your future.
All right.
And can I proceed, Andrea?
Okay. Yes, doctor.
Yes, Andrea. So this much is need removal. You can have the two approach, either this keyhole surgery on the open surgery, but the keyhole surgery, depending upon the available expertise, we can decide, because sometimes this much cyst, we should not rupture the cyst. The cyst should not spill inside the tummy cavity while removing. And so depending upon the expertise, you might require either the open surgery or the keyhole surgery also. And
okay, got a point. Okay.
After optimizing your health, and then after the sleep doctor review, we can plan your surgery.
Okay.
Do you have any other questions? Am I clear so far?
Well, doctor, I think I'm getting myself informed about all these things. Yeah.
Yeah, Andrea, I given so much information, and if you and I will give the some information leaflet, and I will connect it to the counselors also, because if you wish, I will connect it to the support group too also.
All right, doctor,
And
that's fine.
because if you wish, we can admit you, and we can plan the further evaluation for you.
All right. Yeah, doctor, that
Okay.
sounds right.
And you can talk to your family members and tell your decision. I'm here to looking after you.
All right, okay.
Okay. Meanwhile, I'll inform my consultant regarding your case detail.
Great.
Thank you, Andrea.
Thank
I'll
you,
give the admission note for you. Thank you.
Thank you, doctor. Well done, my dear Prasanna. So you got 5 more seconds left. So you finished in 9 minutes and 55 seconds, covering almost everything. So your introduction, your empathetic tone, you speak clear and simple and understandable English with necessary audibility. So that was that's a very good performance from your side. However, a few things I have put on from my side. So your introduction, confirmation of purpose and agenda is the same. Concerns and expectations. Ask about the duration of the onset, the duration, the progression, about the pain, about relation with the waterworks, the frequency, the sex, the bowel, nausea, vomiting, any lapse of appetite, any tired feeling, weight loss, chest symptoms, very important differential diagnosis. Right? So I see doctor is the one who always keeps the differential diagnosis in mind, starting from the history classifications, not just your management options. So gynecology is the LMP, the smears, whether she has gotten, not the smears. Here you shouldn't ask smears because she's just 21. So the LMP asked about the painful periods, any contraceptions. Obstetric is routine question, medical history, any allergy or clots, surgical same family history of ovarian, bowel, and breast cancers. So social history of smoking, alcohol, drugs, occupation, and BMI and support, and try to always get the differential diagnosis in the mind. Apply knowledge, simple. This is a full sack of 60 centimeters. So she has to go for a MRI. So when I asked Sinister, you said it doesn't unlikely. However, you also put that you put me in touch with a consultant. Also, you have to say that you'll have to do some special scans, MRI scan, to make sure of how things, whether this is really sinister or whether she has got something to do that that might put her into trouble. Okay, so you cannot just judge everything with ultrasound. Here, unfortunately, there's no medicines, there's no waiting period. Surgery is the only option. So you can give a sick note, as they correctly told, to the university to get an exemption. And even if you do a surgery, we'll be applying the enhanced therapeutic principle so that she can get back to her whatever she's doing, her exams, her college, and everything. All right. So it's just say that even if you do a surgery, we'll apply the enhanced therapeutic principles, and we'll be putting you back into your own. I will be putting you back into whatever you've been doing, all right? Back to your normal routine. So surgery could be a keyhole operation or an open operation. And as you correctly mentioned that there is in taking in view of the big size of the cyst, there could be risks of oophorectomy as well. So the whole ovary could be lost. However, she can still have her periods from one over, because by we keeping one ovary intact, she can still have a periods normally, as well as the babies also in future. So if she waits, if she gets herself getting herself postponed, then the risk of ovarian accidents could be a twist or trauma or a bursting of the cyst inside the tummy, which might put her under an emergency surgery and sometimes heavy pain and becoming unconscious. So that would be a difficult thing. So assure that from on ovary, she can have the periods and the babies in future. So close with the patient information leaflet and support group. All right. So that should be your closing statement. Right. So any doubts with this, my dear Prasanna?
Ma'am, here no need to admit her, no, ma'am. I said admission because she
you have to admit it.
Okay.
She's very tall.
Okay, ma'am.
Because she said she's coming from the university and all that. Or if at all if she wants to go back, she has to come back at the earliest.
Okay, ma'am. Okay.
Yeah? So whenever you say admit, say her that you'll be there around the ward to address her concerns.
Okay, ma'am.
Yeah, and always say patient information leaflet and support groups, even if you admit her or even if she's an inpatient.
Okay, ma'am.
Yeah?
Okay, ma'am. Okay.
So anyone else, any other doubts?
And here they clearly mentioned it is a simple ovarian cyst, and appearance, the morphological appearance also, it's like a simple one, ma'am.
So anything under the microscope is the final for us, my dear.
Okay,
Anything
ma'am.
under
So,
HP is the final. So you ought to be a safe doctor, saying that we'll be doing some special scans. We'll be also putting in touch with not only with the consultant, as well as with the gynecologist, that the doctor who is a specialist in treating female cancers.
okay, ma'am. Okay.
Okay.
Okay, ma'am.
So anything under the microscope is final unless and until we do that, we are not sure. We will not be 100% sure of this is only semester. It could be anything as well.
Okay, ma'am.
Right?
Ma'am,
Yeah,
whether
so,
it is a passing station, ma'am, or
definitely it's a passing task. But I would like you to be you are fluent and you are up to the point. But just work on these few things that I told you.
okay, ma'am.
All right. Thank you
Okay.
so much. So
Thank-
anything, any other doubts, guys?
Yeah, can I ask you one question?
Yes, Dr. Salma, please.
Yeah, so yeah, I agree with you that what you told, yeah, that only that to remove the seed, yeah. But here it is given the LDH is normal, alpha fetoprotein normal. So you think if it is not given, only scan report and C125 given, so at the time we can offer her for this LDH and alpha fetoprotein and beta HCG. It's not given in the question.
Yes, definitely, because she is. Look at the age group. She's 21.
Yeah.
So definitely you'll have to send her for all these things, the LDH, the alpha fetoprotein, the HCG. So you have to do it because, as I told you, the safe doctor is the one who's got the differential diagnosis in her mind. So you ought to give all this if it's not given in the list, right?
Yeah, but my question is, you know, the guideline, it is written that if it is complex cyst and then if it is less than 30 years and complex cyst, but it is simple cyst. So do you think that we can suspect that any cancer?
Anything under the microscope is the final. The histopathology has to say that this is non-sinister. Unless and until that, you cannot 100% say that this is a straightforward non-sinister simple cyst. However, it looks simple. It looks simple with all these things given here, but you'll send her for the special scan. And also, you're a safe doctor. So I told you in the beginning, maybe you didn't attend that. As you are a middle grade doctor, you will seek opinion from your consultant as well as from the concerned specialist. All right. So you cannot 100% decide on your own. You're not a gynecologist.
Yeah. And another thing, do you think we can say about the that we calculate the risks of cancer, like RMI index to calculate?
Yeah, you're right, Dr. Salma. But here, RMI is very, the IOTA and RMI are very, prompt in doing and classifying the post-menopausal cyst. We can do for a premenopausal cyst. However, with the limited information that is being given to you, you always ought to, just with a mere ultrasound scan, you just cannot say that this is a simple cyst and, finish the task. You ought to be a safe doctor. Send her for an MRI and send her for the gynecologist.
So no need for RMI.
You're a general gynecologist. Yeah, you can say an RMI. You can say an RMI, but that may not be the most appropriate. They say yes, the same thing holds good when you do the same similar situation for a postmenopausal.
Yeah.
Now, postmenopausal we have to do, but here you know that as scan report says it is simple cyst, so that means the RMI index will be also 0.
That's absolutely fine. That's absolutely understandable. That is theory.
Isn't it?
That's theory.
Yeah.
That's theory. What if she comes to your clinic? You'll say, okay, your RMI is 0, go away, I'll do that. You don't, right? You ought to be a safe doctor to pass this exam.
Sorry, I cannot hear you properly.
No, that's theory. That's absolutely theory. I totally get your point. However, when a woman comes to you in your clinic, do you really do that? Or do you just would you mind doing an MRI as well? Or would you mind taking her to the senior? So see, Dr. Salma, at the beginning, I told you, you ought to be a safe, a knowledgeable, and empathetic middle grade doctor. With good communication skills.
As a whole, I'm asking you, RMI will be, because that RMI is M for, the postmenopausal or premenopausal. You have to multiply with ultrasonography.
See, I will not quote the RMI and say that this is a simple system, close the topic. Get the point? So I will not just take the RMI to my advantage and make the statement that this is simple, and maybe I might misguide her. I might be an unsafe doctor.
Yeah. So no need for that, because even though
I will not say from me. If you want, you can say, but I will not make RMI as a quote to say that this is only simple and you do not have to go for further on. I will not do that.
Yeah,
so
I will not do that.
Yes.
No, I'm not talking that. Yes, in this case, will not
in
do
the task. I'm telling not in the clinic. No, I'm not telling in my clinic. I'm telling in the task.
Yeah.
If I'm being given this task, I will not just quote the RMI and say that the RMI is 0 and so there's no any further investigation needed. I will not say that. So I will definitely put her in touch with an oncologist. I'll definitely send her for a higher scan, that is the MRI scan, because I want to be a safe doctor, and I am a middle grade doctor who will always seek guidance from my consultant, from this concerned specialist when in doubt. So that's what I am. I'm an ST5 doctor. So I have to keep up that, isn't that? So that is what is expected out of you in this exam. So in the beginning, I told you. Yeah. Right.
Yeah.
Thank you so much.
Thank you.
I hope I'm clear with this. Yes. Any more doubts in this task?
Yes.
So any other doubts in this, please? All right. So if there are no doubts, then thank you very much for joining the session. And this recording will be uploaded in the YouTube, and you'll be given the links for that. And you can listen to that and get yourself familiarized with whatever we have spoken. And depending upon the dates that PASUT is going to announce regarding the further booking, we will be arranging for another session as well. However, again, my hearty congratulations to all those who booked, and my kind request for all those who couldn't, please don't give up hopes, because this is the technical glitch from their side, and they've indicated in the website also that because of this issue, they apologized and they reassured you that they'll be giving you alternate booking tokens, and they've sent mails to so many candidates. So let us wait patiently together. Let us hope and wish and pray for the best for each and every one of you. So please remember that each and every one of you will be successful and you will pass with high scores. Having said that, I wish you a pleasant evening and good night. Thank you so much, and bye-bye.
Thank you so much, ma'am.
Thank you.
Thank you very much.
Thank you ma'am.
Thank you very much. My pleasure.
Thank you very much, ma'am.
Thank you. Thank you, my dear.
Ma'am.
Thank you. Bye-bye.